Well, it's a little bit after 7 o'clock here, so might as well get started. So make sure everyone stays on time and gets their evening back as such as we can. Scott, I'll hand it over to you.
Okay, so thanks everyone for joining us this evening. So my name's Scott Lang. I'm a family doc. I think just looking at the list here, I've met many of you before, either through my training or through other means. Yeah, thanks for joining tonight. We've got tonight we're focused on eReferral and an initiative we've been working on through the Ontario eServices program, the Middlesex London Ontario Health Team, as well as the London Middlesex, excuse me, London Middlesex Primary Care Alliance. And it's the initial phase of what we're calling the eFax for referral projects. So couple of housekeeping things before we get started tonight. So just to make sure that everyone has a good experience, we ask that you please stay on mute if you're not speaking. And if you can use the raise hand feature to ask a question. And of course, the chat will be available throughout the night. If you want to put in any questions there, we can address those when we get to the question section. And just a reminder for everybody as well that the meeting tonight will be recorded so that it can be available for later use and viewing for anybody who's not able to attend tonight. And the slides will be available as well. So before we get into the main content, just a little bit of background information. I think most people know about it, but the London Middlesex Primary Care Alliance. So it's an inclusive network of primary care providers leading with a unified voice to improve the health of our community with a goal to create a strong and united primary care network to lead system change utilizing quintuple aim values, drive health equity and continuous quality improvement for the best possible experience and health outcomes, advance patient-centered equitable care in partnership with those we serve, and to improve integration of primary health services with public health and other social and healthcare partners. So for tonight, we've got a couple of objectives. So the first objective is to understand or explore a little bit more about Ocean eReferral and how it is used within your EMR. To learn how eReferral via eFax, which is the new initiative that we've been working on, and see how that is used in Ocean. We'll have a couple of demonstrations with Telus, so PS Suites and Accuro. And then we'll also see how to enter appointment information onto Ocean when we get a referral back through eFax. And then also a little bit of information about how you can sign up for Ocean eReferral, which has no costs since that's covered by the Ontario eServices program. Also there's a couple of extra things at the end about some leadership opportunities that are available for primary care and some updates on OHT related projects that will affect primary care. And just as a reminder, this is at the bottom here, you can see this is a 1 credit per hour group learning program, and it's been certified by the College of Family Physicians of Canada. So don't forget to log your main pro. So we've got 2 main presenters tonight. So the first is Vineet Nair, who's a family physician. He's the co-chair of the London Middlesex Primary Care Alliance, and he's also been a member of the eReferral working group. And then we've also got Tian, member of project manager for the eHealth Center of Excellence. And he's also been a member of the eReferral working group. And together we've been building this eFax addition to Ocean, which we will talk about very shortly. And just a disclosure for financial support. Actually, I guess Vineet, you can. Yeah, I don't have anything to declare. I was paid by the Middlesex London Ontario Health Team for my master's internship, and then a little bit for this project work, but that's all for me.
Yeah, well, thanks, Scott. Yeah, so in terms of our disclosure slide, so just the project has received financial support from the OHT, and then in this project funding for clinical waitlist management from Ontario Health, and I've gotten paid as part of this working group project. So no conflicts of interest, just kind of spreading information about the project that's ongoing. So yeah, we're here to talk about eReferral, and I thought maybe we'd start by talking about why I kind of got involved at this stage. I mean, there's always lots of projects going on with the OHT, and it is lots of asks of our time for it. But eReferral is one that I think really spoke to me, because I think it's such a pain point for so many of us in terms of how to handle referrals, the time spent in trying to find the right referral to make sure they see that particular problem, to find out if it happened or not. It's just so much effort and time spent on it that I thought there's a lot of potential for improvement here. So I kind of really thought being involved with it would be rewarding, and it has been. So just in terms of background, I guess, or just general thoughts for those that don't know what Ocean is or what eReferral is, it is a secure and seamless transfer of information from one EMR to another EMR, basically from us in our EMRs as a primary care provider to this EMR of a specialist, avoiding the fax. It's secure, it's web-based, and ideally integrated within the EMRs. So Ocean is that platform that's used within this project. It is integrated with the most common EMR systems, TS Suites, Accuro, and Oscar. And this was the one that was chosen for this project. But in terms of why we wanted to move towards this, I think just reminding ourselves what the current state is when we're talking about referrals in primary care. If you're not using Ocean eReferral in any capacity right now, and you're still using basically fax from within your EMR, which is much better than it used to be when it wasn't within our EMRs, it was all outside of it, but it's still a lot of work, right? If we look at what happens whenever you want to make a referral, you decide you want to make a referral, we have to go into our own EMR directories. And I think this is something we have to realize, that we have to all maintain our own EMR directories, which is somewhat unbelievable that every single office with every single provider has to have their own directory with updated list of specialists, what they see, have some way of organizing it, and hopefully reasonably easy to work with. If somebody retires, it's up to us to remove it. If someone moves into the system, we have to enter it in. If they change the referral form, we have to update our EMR system to update that referral form. So that's a ton of administrative work. But say you found your specialist you want to refer to, you fill in the paperwork, you fill in the referral letter, you add the required information, and then you fax it off. And it is an eFax, right? So it's pushing a button on your computer, it's still via fax. And that leads to the bunch of the questions in fax land, right? Like, did it actually get sent? Because there's a known failure rate for these faxes. And so is it a problem on our end? Is it a problem on their end? Did they receive it but not see it? It got lost somewhere. And did they see that problem at all? Like, did they actually see the problem you wanted them to see? And if not, then it has to get redirected. And how do we find out about these things? We have some ways that we all kind of have some workarounds. We want to double check on these referrals to send ourselves notes to follow up on this referral. But that just means that somebody has to call that office and ask somebody, and wait on hold and hopefully get through and figure out whether they got that referral or not. Ton of time spent with that. And then also just, if they do see that problem, they book the appointment for the patient, who's going to contact that patient? We know that it's supposed to be done by the specialist at this time, by the college, but it doesn't always happen, as we know. And then also, there's no guarantee that we'll be told when that appointment was as well, so that if the patient calls us because they didn't understand the message or they just lost the appointment time, we may not have that information ourselves in terms of when that appointment was. And of course, we also have no insight in terms of wait times when we're making that referral. We're just hoping for the best, and we get that first appointment back in 6 months. We'll try somebody else, see if we get faster. So it's a lot of work in the current state of workflow. Now, if you're using Ocean eReferral as an early adopter right now, it's a little bit better in some ways, but there's still some challenges for sure, right? There's two workflows is the biggest problem, right? So we have to make a referral. If you know that referral person is on Ocean, you can open up the health map. So the health map is the directory of all the specialists that are on Ocean right now. You'll see a little map with the house. It shows where the patient lives, and you'll have a list of people that you can refer to, whether it's based on a favorite list or searching for something specific. Each directory has some information about that physician, like what problems they see, what they don't see, what kind of information they want you to have before you even click to refer to that person. And then it opens up to a customized referral form that the specialist has created, which you can fill out, attach any information you attach, and you send it off electronically to the specialist. In this way, the patient gets email notifications every step of the way. When it's been accepted, when you've got the appointment, they get notified. So that's already built in if they have approved consent for email notifications. And then you can look onto Ocean, the dashboard, to find out the state of this referral at any point in time to know that it's been accepted, where it's at in the flow for that particular referral. But if it's not on Ocean, if that specialist you want to refer to isn't on Ocean, then you're back to the old flow, right? You're going back to your EMR directory, you're looking for the same list, and you're sending a fax and going through the same problems. So the desired state that we're hoping for is that we move towards a time when everybody's on the same platform for eReferral. So you go on that map and you can see anything and anybody on that map, and you can send a referral electronically, and patients get notified all the way through. All of that information as far as the directory updating is done by Ocean. So if a specialist retires or changes their focus of practice, they just have to tell Ocean to update their listing, and it's updated for all of us. If somebody retires, it's removed from Ocean, updated for all of us. If they want a specific form to be changed, they can update it on Ocean, and we're all updated. And then we can also use that same platform to track our referrals all in one place. If you look onto Ocean dashboard, you can see which ones are outstanding, which ones are late, which ones are waiting to be seen, and we can get a snapshot in one location. So that's our desired state, everything on Ocean. But we're far from that, obviously. But how do we get there? And that comes to this whole chicken and egg problem, right? That for us, for primary care, there's not enough specialists that are on Ocean right now to make it necessarily worthwhile. Like, there's still a lot of value to it. You know, a lot of the DI clinics are there, so you can do all your X-rays and outpatient imaging on Ocean, but there may not be enough specialists to your liking to make it worthwhile to have these two different workflows, because having two different workflows is a challenge. And then for specialists, there are benefits to being on Ocean for a specialist in terms of they can update their directory listing so they have all that information there about what they want the patients to know, and to be really clear on what types of problems they see, so that people don't make referrals that are inappropriate for them, and they can design their referral form how they want to make sure they get the information they need, to make sure they get a full and complete referral that they want. And they also get the demographics inputted directly into their EMR rather than having to create a new chart every time they get a paper referral. But if they're seeing that only like 10%, 20% of referrals are coming via Ocean, they still need two workflows as well, and it may not be worthwhile for them to do that change. So that is the problem. And the solution is eReferral via eFax. By having more options on the map that are either on full eReferral, or if they're not, there's an eFax option within Ocean. It allows us to make more referrals within the Ocean map and get more benefits for the patients in terms of the email notifications, and in terms of having that platform to use it and having more data about that referral and a more accurate directory listing. And by doing so, we can sell and show that there's value to this to physicians, right? We can say this is more valuable now. There's more people to refer to. It's time to make that change to Ocean eReferral. And that will help us then put pressure on specialists to say that, listen, this X percentage of family doctors now using Ocean eReferral, it's time to come on board. I think, we've always spent time where we've had these clinics say that we'll only accept referrals using this specific form. Well, maybe it's our time to be able to say, we're referring using the eReferral option, eFax option. It's time to come on board and join us. So the problem is this whole chicken and egg issue, and somebody has to make that first step. And I think it's really a chance, an opportunity for us to take the lead for a change and really drive this and drive the system in the way that it needs to go. But somebody has to make that first step, and this allows us to do that. So primary care can really lead this change. So the new workflow with Ocean eReferral by eFax is that when you want to make a referral, you go onto the Ocean eMap first, the health map first. You'll have a directory listing of all the people that are on eReferral, as well as those that are on eFax, eReferral by eFax. This will increase the number of people that are available to use Ocean eReferral for. We've added 60-some doctors, specialists onto that right now. We're looking at increase that up to about 110 by the end of this week. So that really is a significant bump in the number of options when you're on there. And I found already that by going just to take a look, I'll see people that are on eReferral that didn't even realize were on eReferral in the first place. So it kind of increases the opportunities to use Ocean eReferral. So when you're on that, if it's an eReferral, then it gets sent electronically, right? The patients are notified all the way through. They get the email notifications. It's updated as far as the appointment times are updated within Ocean. So it's all done for you. The add-on now is that if they're not on eReferral, but they're on eFax, now that referral is no longer a design form by the specialist, but it's the standardized form that we as a group have put effort into. Scott put a lot of work into this, looking at what are the guidelines for referral forms, what are the standards that are required for a good referral form, what makes up a good referral form, what are in common referral forms that are used. So we can design one that's got all the information we need, but not a whole bunch of boxes to click and a lot of clutter that makes it hard for primary care to complete. And then it gets faxed from Ocean to the specialist. So the specialist receives it the same way as before. It's a fax, basically. It'll look the same. They'll have a different cover sheet maybe, but it's going to still be just a fax, and their workflow doesn't change. They just submit the, write down their appointment time and fax it to us. Now, there is one change in terms of how we handle that now. So, sorry, I'll get back to that. With the fax itself, the faxing is being tracked. They're looking for failures, they're managing fax failures, so you don't have to worry about, is it going to be sent or not? There is some background work being done to make sure that it gets sent and received. Now, when they get that referral and make the referral appointment, it's going to come back to us, and the ideal way it works is that when we get that referral, we enter that information back into Ocean, into the dashboard to complete the loop and allow that email notification to happen to patients. It is an extra step for us, but it is hopefully temporary until we get more people on the full eReferral option. Now, there are a couple of things just about that, just so you're aware that we're not, not trying to pile on us at all. It was not the original design. The hope is that we would be able to have the specialist refer to a centralized fax number at eHealth Center for Excellence, and they would be read electronically, digitally to enter the data automatically into Ocean. There's been some hiccups with that in terms of the ability to read those kind of forms. So they're working on that now, so hope that'll be resolved. So that's one thing that's in the works. The other is that when you make a referral within Ocean, there's an automatic reminders that are built in. So if you haven't heard an appointment time hasn't been entered into Ocean 30 days after you make a routine referral, you get prompted. So that at that point, you can look into your EMR and say, has this referral been made or appointment been received or not? And if it has been, then you can just enter it in at that point to close the loop. So it's 30 days for routine referrals, 2 weeks, I believe. Is it 1 week or 2 weeks for the urgent ones? So there is some backstops for that to help us out with that. So that's the proposed workflow moving forward. Now, the benefits are there for everybody in terms of this, I think. I mean, for the patient, it's improved patient experience. It allows email notifications on their referrals. You get to notify, they're in the loop now. We've already seen patients getting notified now for referrals that never would have been notified if they hadn't been using the eFax option. For us, it provides more opportunity to use eFax and not have to worry about the fax part, but also be able to be confident that there's a system in place to track the referrals and follow up on them. It helps with this migration phase. I really feel like we're pushing the envelope to move towards a more of a eReferral modern way to send information. Obviously, we're looking to axe the fax, so removing the fax from the equation and all the failures in the work that it creates for us. And it does provide insight for wait times, because as we get information from when the referral was made to when the appointment is, the system tracks that wait time, so that when you're making the referral, you can actually see who has this longer or shorter wait time when you're choosing who to refer to. So giving patient more information so they can choose who they want to see and when they want to see them. It's a lot of benefits that we may not even realize we will get until we get this system working up and fully. So that's me talking about it. I think the next part is to see how it looks for you in your office. Eric is going to take us through a demonstration of this through both Accuro and Telus. But there's any questions that kind of came up while I was talking there, but we can maybe answer them as we go further on into the talk.
Okay, thank you, Vineet. I'm going to share my screen.
Yeah.
Sorry, I see there's a question. Yeah.
Sorry, I see Denise has a question. Denise wanted to ask a question there?
Yeah, I did.
Hmm?
So I just want to ask, can you make comments to send back? So for instance, somebody's referred about 2 things, but you only want to deal with 1 thing, or you don't want to deal with 2 at the same time. Can you send a comment back on the form to say that, or you have to build that in somehow?
So if somebody is on full eReferral option, then there is that ability to ask for more information or to provide more information back, and then that gets flagged on the sender's end, and you can have a conversation that way about that or make the changes. If it's the eFax option, then it would still have to be written on the form and sent back to the usual workflow.
Yeah, no, because I actually review all the referrals. So sometimes something that a patient sent about is completely not what I would deal with, but the other part of it is. And so if you can't notify people about that, then the patient comes with unrealistic expectations.
Right, Denise, sorry, yeah, I can quickly comment on that. So if you're a digital receiver on Ocean, there's actually a functionality called split. So as a receiver, you will be able to manually split a referral into 2 separate referrals, or you can have an automatic split function turned on, so they will split it automatically for you. So in case you got 2 referrals for 2 reasons or two advices they are looking for, you will be able to schedule them separately, or you can decline one and accept the other one depending on your situation.
Okay, thank you.
I would also say I've seen some clinics will send a message back because they are able to communicate back through Ocean, just saying, you know, I will see for this part, but not the other. And that can be just as a text communication in eReferral. I see there's another hand as well with Jessica.
Hi, everybody. Thanks. So I'm Jessica Project. I'm a pediatrician, but I do primary care as well. That's why I kind of jump in on your meetings. But I do provide specialist services. I had a question when sending referrals, how much back and forth is the patient actually seeing? So if someone wanted to make a comment that maybe we didn't want the patient to see, are they seeing everything that's going back and forth?
Yeah, Vineet, I will take this question. So yeah, so basically the patient will be notified at a few certain points. The first time the patient will be notified is when we send out the referral. So they will get an email saying, hey, you got a referral sent by this doctor to this clinic. And the next email the patient will get is when the appointment is booked. So if you have multiple conversations in the middle before you schedule the patient will not be notified. It's until you get you put in a set date and time in the system, then the patient will get a second email about the new appointment they got assigned. So the third one they are going to get is when you reschedule. So let's say you updated the appointment type to a different date and time, then they will trigger another new email. So those are the 3 kind of emails the patient usually gets. They will see all your comments or conversations back and forth.
Okay, awesome. And just one last thing, is this, like, do you have to be part of Ocean and pay into the Ocean system to be part of this, or is this something separate?
Okay, so our company is called eHealth Center of Excellence. So we have an agreement with the OH to support the eReferral deployment. So if you sign an agreement with our company, so our program, our Ontario eServices program, basically your fee will be covered. Does that answer your question? Sorry.
That does, and I guess I'll have to reach out to someone to get signed up for this.
Yeah, later on I can leave a little contact information in the chat, so you can just follow the link and contact us.
Yeah, there's
awesome. Thank you.
We'll provide information about the people that are interested in signing up at the end, towards the end. Jennifer, I have one more question. We'll move on to the dental, so that might answer some of your questions as well. Jennifer?
Yeah, sorry. I was just wondering, I work for a family doc with OB, so we do referrals. So again, with the cost, so if she was to sign up for the referral section, there would be no cost. It would still be covered. In future, is there going to be a cost? Is this just a first sign up kind of thing, or is it always going to be covered?
Yeah, Jennifer, that's always like a very common question people might have. So for the senders, there will be no fees. So for the receivers, there's a possibility there's a future fee, but it is covered by our program as long as we are funded by the ministry, right? So our program will cover all the costs happening now for all the receivers. We cannot guarantee like forever, but as long as we are covered by the ministry, you should be covered as well.
Thanks, Eric. If it's okay, well, Denise, can we just go on to the demonstration and we're going to take time for questions at the end? There's more time for questions, if that's okay. I'll keep that in mind for make sure we get to you at the end. Thanks.
Yeah, thank you. Thank you, Vineet. So first, I think I need to do the disclaimer, like I have no point of conflict as well, because we are funded by the Ontario eServices program to perform this eFax project. I'm going to share my screen and I'm going to demo 2 commonly used EMR. One's called Telus PSS, the other one is called Accuro. I don't know if any of you are using Oscar. If you need me to show you some functionality on Oscar, I can also quickly do that. Just want to make sure, because today we're going to focus on eFax only, I assume some of you already use Ocean before. If you're not familiar with Ocean, you can reach out to us and our team will help you to organize another demo if you want to know more functionalities. Today, we will be focusing on eFax most of the time. So is a test patient in my Telus PSS. You can see I have the patient chart open. So after you have the integration with Ocean, you will have a little toolbar in the middle of your screen. So what you really can do is just click this refer button to launch the destination you want to refer to. I will just quickly select a lab value as attachment just to show you how the attachment works. I can just quickly, we call it green bar, and click the refer button. So what happens is the system will just create the attachment. And with the default date and times, I will just click yes, and the system actually will launch something called Ocean Health Map. So you can see it looks like a Google map. It works actually like a Google Maps. You will be able to search for any specialties, any doctor's name you are interested. I'm just going to search eFax for now, and you will see, because I'm now in the London area, I will see all the doctor's name who has an eFax in it. So you will notice in London region, we have enabled 62 doctors so far. Like Vineet said, we are going to include another batch by end of this Friday. So we will have 110 receivers in total just for eFax solutions. So you can see we got a lot of stars on the map at the same time. So you will be able to drag the map to zoom in, zoom out, and refresh the listing. So you can see the information. So whenever you select a doctor, you can see we do display there, like how far it is from your patient, where it lives, and what's the specialty they are in. For example, if I go into Dr. Adita, so I can see their contact information, there's a little disclaimer to explain what is the eFax project. And we can see this is a dermatologist, and you do have a little button to click to launch the referral form. So once I click the referral form, you will notice a standard form will pop up. This form is designed through our co-design session with a lot of local physicians input and led by Dr. Scott Liang, right? So we have it assigned to the majority of our receivers as eFax receivers. You can see the patient demographic will all pre-populate. I have an email documented, so it will show right here. And we do have a body of the referral form we need to fill in. Before I jump into here, you can see on the bottom, the CPP will be pre-populated as well, including the medication list, current diagnosis, past medical history, and allergies information. And you will notice there's a little eyeball, which is the attachment I just attached. If you click that little eyeball, you will be able to see, this is just a create adenine level I just attached. Sorry, I made it bigger again. So on the bottom, if you sign up with Ocean, you will have all your information pre-populated as well. What we really need to do, just go into the body of the form, you will see this little asterisk. Those means it's a mandatory field. So we have to give the answers to those 2 questions at least to finish the form and send it out. If we, for some reason, missed one of the mandatory field, when we click the send, system actually will bring me back. They will tell me, hey, this answer is not valid, and you have to go back and answer it. So this is a very high level process. I'm not going to send it out because this doctor will get my eFax. So what I'm going to do is I'm going to switch back to the test mode and send one to my test listings. So I will search for my name again here. So you can see I have an eFax demo site here as well, so I can quickly fill in the form and send it out. So again, everything should be pre-populated. I can just decide the urgency, whether it's a routine and urgent. Why this is important is because later on I'm going to show you, we do have some logic built into the form. Something we call, one is called a retry logic, and the second one is called a reminder logic. I'm going to explain later on. So let me just quickly type in something here and send it out. I will put diabetes to reconcile the medication. So I will use advice, and I'm good for now. So I will just click the send button and it will be sent out. So system will ask you questions. Do you want to use the email to send a notification to the patient? I will say consent given and go ahead. So this is the final confirmation. And now as a sending physician, you will get a little receipt showing that, hey, this referral has been successfully sent. What happens in the back is our system will capture this information and transcribe it to a fax and send it to their fax machine send to this fax number using our eFax services. So what happens is usually in 2 or 3 minutes, depending on how long my attachment is, they will the other side will get a fax through their portal. So later on, I will be able to show you what it looks like on the receiver's end when they get it. Any questions before I jump to the next part? Okay, I assume we're good. So what happens after I send it out is if I launch this patient chart again, so you will see this information actually will create a new record in your patient EMR with something we call it ocean tracking toolbar. So it will show you which doctor is the receiver, what is it about, and the current status. If you in the future get any messages, the messages will always show. Once the patient is booked or updated, the information will update real time here in this place. And we will also got a little summary as what we have sent to this doctor. So I'm going to switch to Accuro. So you will find the process is very similar actually. Again, you launch a patient record. What is a little bit different in Accuro is you need to create an attachment before you send it out. So what we do is here is you will use a little template you pre-designed. I built one called blank ocean letter. I will just create a new document. So once you click this, you can select the date and open the Accuro template. You can see it's a totally blank template. What I'm going to do is just create an attachment for my referral. I will just create a generated letter here. So you can see there's a blank letter just generated. On the left lower corner, we do have the ability to add attachment. I will just quickly select, go to the patient chart, and probably I will find a document. I will use the creatinine level as well. Just use this one as my attachment and click OK. So once I have it attached, I can click save it as a PDF because I don't really want to fax it out. I will click save as a PDF and click send letter. What this send letter means actually means you will send it to Ocean as an attachment. So I will say yes and send because I don't need any recipient. It will go to Ocean directly. So now it's sent to Ocean. What I'm going to do is I will use this little airplane on the bottom. We call them a CDS button. So what happens is once you click that one, it will use a similar approach. They will launch the health map. You can search for any doctors you are interested in and find a destination. Another question I just saw in the chat is how do we track the wait time? So for example, if I'm searching for ultrasound, for example, ultrasound, I will see all the clinics who's providing ultrasound in this area. If I click ultrasound, you can see there's a wait time displayed for each clinic. This wait time actually is calculated automatically by Ocean. So they will use the time when people receive the appointment until the appointment date and time to calculate how long it will take your patient to be booked in this clinic. So you will be able to sort them by distance and sort them by wait time. So if your patient don't mind, like this is pretty close to them, right? 8 kilometers, and it takes 22 days to book your patient in my health center here. So this is just a quick way to see the wait time. One of the benefits of our eFax solution is we are going to have the wait time calculated for those eFax receivers as well. So you will see the process will be very similar. If I go to the eFax, search for my own name, Eric Tian here, I will find my list. I will be able to launch the form. You can see the form will look exactly the same. I can just fill in the information and send it out, just like what we did in Ocean. In PSS. So after it is sent, sorry, let me go back to PSS. After it's sent, if I'm going back to my Ocean portal to track that patient, So you can see this shows all my referrals I sent earlier. It should be someone right here today. This is the one. Oh, sorry, that's not the right date. Interesting. Sorry, let me go to my Ocean portal and see if I have received that one. I have a lot of buttons on the top blocking my screen. Okay, so if I go to my Ocean portal, so this is everything happening in the back end. So you can see we have an Ocean portal, including all the patient information. I can see which doctor sent it to which receivers on my portal, and it's successfully sent. If I open one of my Ocean, my eFax server, so I should be able to get the paper fax already. So you can see I'm still using an eFax server on my computer just to track all the referrals I got so far. So you can see I got a new eFaxes here. If I click view, you should be able to see this is from which doctor sent to which doctor. We've got a little cover page on the top to show you, hey, this is confidential information. It's sent by our eFax eFax project. And you can see, you will see the patient information, the sending physician information, recipient information, and all the details, including urgency, what you have answered for all those questions, and your attachment. You can see the attachment will be added on the bottom of the PDF. This is what the receivers will receive. So what the receiving clinic will do is they will review the referrals, and they will decide if they are going to decline it or accept it or book the patient, use their normal way. So after they have booked your patient, usually they will fax it back to you, to the primary care physicians, right? So what we can do is we can click the portal button. I'm going back to my Ocean portal. And if I go to my sent, awaiting response, you can see my patient list on the very top, Toyota, is right here. And if you receive that appointment information outside of Ocean, you can see if you scroll down to the bottom of the patient record, you will have something called scheduling section, where it allows you to enter the appointment date and time. This is usually not available for the senders. You will only see this section for the eFax patients. So it won't show for normal eReferral patients. So yeah, for someone, if you're not familiar with Ocean screen, so this is when we open the patient record. You will see the patient demographic information, the sending physician's information, a summary of the referral is sent out, and you will have a little messaging section. Will show you the little attachment we attached. You can see, because eFax receiver is not an Ocean user, we have turned off the messaging section, so you will not be able to do the bidirectional communication to the eFax receivers. So another thing I want to mention here is, remember, we have two logics built into this eFax process. One's called a retry logic. What happens is we notice that the fax have a roughly 20% failure rate as an industry standard. So what we have built is a retry logic. So if fax is failed on the try, so we will have a retry logic built in. So if it's an urgent eFax, we will try it in 2 hours for 10 times. If it's a regular routine eFax, we will try it 10 times in 6 hours, just to make sure this one can be resent. If we hit a busy line error or no answer error, this kind of error can all be retried. So through using this retry logic, currently we can cover about 98% of the eFax can be successfully sent. So we have gone live since May 24th in our region, and we have processed 82 eFaxes so far, and all have been sent successfully. I'm going to just quickly add a little, let's say, imagine we got appointment date and time sent back to me, and I can quickly click the calendar, enter a date and time, and click the save button. I will be able to also add some comments here. So please bring $5 for parking, if that is showing on the response you got from the specialist, right? So you can click save, and that one, oh. So I got this little notified pop-up, which asked me, hey, this patient seems to have an email documented. Do you want to email the patient for this new appointment date and time? I will click yes, email, and the patient will be emailed for this appointment date and time. Another logic I want to cover here is called a reminder logic. What happens, like Vineet said, if you haven't received this appointment information, if it's an urgent referral, we will send you a reminder in 7 days, says, hey, you didn't get any answer from this specialist. Please follow up about the appointment. If you have already got it, please update it in this scheduling section. If it's a routine referral, the reminder will happen at 30 days. So when we book this patient in the system, and oh, for some reason it won't save for me. Okay, sorry, I have to test it after. So what happens is when we enter this wait time, the system actually will start to collect those wait time information and calculate it and eventually show it on the map. So we can see all the wait time for all our eFax receivers. I will stop here. Any questions for me to answer?
No, that was great, Eric. I did see there was one Oscar user, at least on the call here today. So if we have a bit of time to show that quickly, just to be an equal opportunity and everything, be fair and equitable.
Of course. I'm going to open my browser. So for Oscar user, you should be very familiar with this process. I will just quickly go to my Oscar login and so I will just launch one of my test patients here. I will use PCP as my test patient. You can see once I have I will go to the consultation area, and you will see we do have add attachment from here if you want to attach any documents for your patient, right? Again, I will use maybe a lab here again as a result, and don't close it. You can see there's a little lab included as my attachment. There will be a little refer button on the top right. Yeah, sorry, a lot of screens covering my screen, but once you click this, you will be able to see the map will be launched, right? The map will be launched, and you can follow the same idea to search for a doctor or search for a certain service and find the clinic. Again, I will use my demo listing as a destination and search for it. You can see once I need to log in again. So once I enter, again, I need to fill in this form. Probably I will just quickly enter it. And you can see, again, a lot of information will pre-populate here as long as they are documenting your EMR. I will click send and consent given and correct. So once it's sent, if you go back to your patient chart, that one actually will show under your consultation area. Sorry, that's a very quick demo. So if you are interested, we can schedule another demo with you to show you all the detailed functionalities. The idea is that you are going to still use the consultation section to monitor all your referrals, and you will be able to update the status from here.
Thanks, Eric. Yeah, I mean, I think it's kind of just a great demo to show how it looks. I mean, it is a little bit different from the transition from your EMR to the Ocean, but once you're in Ocean, it's kind of all the same for everybody in terms of filling out that standardized form. Yeah, there are lots of questions in the chat. I hope we answered some of them during the talk, but we are kind of working on trying to get this whole thing to be easier for everybody, and there are benefits, I think, throughout for everybody in terms of the receivers and the senders. And I know the cost is always an issue for people, like in terms of reading the future, but I think as Dr. Schachter said, that we can really push to just make sure that we advocate for this being covered, because I think it is a huge savings to the system overall. If there are other questions, we're happy to take them now. We have some time for that. So I'm going to just share my screen again here, just to. There's some links there for some other resources that are available that we mentioned already. The eReferral, eFax, the videos to kind of demonstrate that. We can look at it in your own pace and time and stop and pause and what have you on the different platforms, Oscar, Accuro, and Telus. And then there's also listed the specialists that are actively on there right now for the eReferral via eFax. This is just the list that are on eReferral via eFax. Does not include the ones that are on eReferral fully. It shows the 60-some that are there right now, but that will be updated hopefully by the end of this week to another 40 or so to get to 110. Again, our goal is to kind of get it to the point where you can have feel confident that if you open up Ocean Map, you can do 75 to 80% of the referrals that you would normally do. You could do them via Ocean. So that's our goal right now. And then if you're interested in signing up or getting more information, just email eReferral at ehealthce.ca. I'll go over to Denise there because she had her hand up earlier there.
Yeah, so the patient is notified about the actual time and date of the appointment, are they? And
Yeah.
are they told to call and confirm?
Yeah, Denise, that's a great question. Sorry, I forgot to demo that to you. So yeah, my apology. Yeah. So let me quickly share my screen. Sorry, Vineet, I will take over screen again. Sorry. Yeah, just want to show Denise some of the messages the patient will get. So if I go to my demo message, you can see there's a few messages I got so far, right? One message is for the patient when we first send out the referral. It shows, hey, Toyota, the referral for this kind of service was sent by this doctor to this clinic. So there's no action required for you, right? And there will be another one to the clinic shows like, hey, you got a new referral, right? So it's for both ends, right? That's another one. So I should have something in my calendar here. I can quickly show you once the patient is booked, what it will look like. Sorry, I have a lot of demo messages here. So we have thought about this. Actually, we designed a customized template just for our eFax messages. The information we want to include is we want the patient to be notified and that they need to confirm. So you can see there's a header was called health referral booked, right? So it shows, hey, you got a little calendar invite. You got this was sent by this doctor at this date and time. It has been booked to this date and time, Friday. And the patient will get a little link here to click here to confirm this appointment. So once they click this, what actually happens in the Ocean portal, we will update the status from unconfirmed to confirmed status. So the senders who is managing the eFax now for the receivers will see, oh, the patient confirmed it. So we also include a little message on the bottom right here to show, hey, if these appointment details are different in any way, from any direct communication you got from the specialist, please contact our primary care physician at this number so we can update it for your record. And we want them to know you will also need to confirm with the specialist if you haven't done so. So that's also all the messages we designed here, just trying to prompt the patient to confirm that appointment with both the primary care and the specialist. Does that answer your question?
Yes, very good. Thanks.
Thank you.
Great. Any other questions on that? We have the full team here, people that know lots about the program and are using it already. So oh, that's great. All right, we're just gonna move on to the. Oh, Jennifer, sorry, I have a question.
Yeah, I had one question. I know that there's a family doctor's office using it, and they're using it to also send patients copies of appointments, maybe from the hospital and that sort of thing, if they get it. Is it similar to sending documents to a patient if you have to send them a lab or anything to go with it for the appointment?
I'm not sure if that's the same functionality here. I think, you know, we have a different service we're using for messaging patients, which will often send lab results or appointment information that way, like just in terms of my office specifically. That's a separate thing from the eReferral part. It's a different module, I guess.
But it's still Ocean, or
sorry?
is it still through Ocean?
I think Ocean has that messaging service in the separate module, I believe. I don't use Ocean for that myself, so I don't know.
Okay.
Yeah. Leanne?
Yes, if the patient says that they did not receive the notification of the appointment, like if it went to their junk mail or something, is there a way to resend that information?
That's a great question. Yeah, that's a great question. Sorry. Yeah, we never, I think there's a way if you update the information again in the chart, in the scheduling section, once you save it again, that will prompt you to send a new email notification out. So that hopefully will trigger another email to the patient. But yeah, I have to test it out. I haven't tried at all. I have to be honest. So yeah, we can connect after. Maybe Jessica knows the answer. Jessica's one of our CM lead in our region.
Okay.
I was going to say that there is the ability to send that out again, both from the sending side and from the receiving side. You can resend that email to the patient.
That's awesome.
Okay, perfect. Thanks.
Okay, and I saw some questions about the CME credit there. Just yeah, I'll get an email after the session here to just remind you to fill out the survey, like the feedback form, then you'll get your credit right away. Yeah, and you also get an email with the slides shortly by the end of the week or so. So if it's okay with that, we'll move on to the next part of the talk. I don't want to take up too much of your time today, just a kind of a short little update on a few things beyond the eReferral, which is one of the big projects being done by OHT, the Ontario E-Services Program and LMPCA, but there are others. So I wanted to kind of have a chance to talk quick about that, maybe some more practical approaches, not for primary care, but also for the health system in general. There's a lot of projects going on at the OHT level and from Ontario Health, and it's hard to keep track of them all, but there are some that are, I think, you know, focused on some of the practical work that we're looking to, that will see improvement in our day-to-day practice lives. So that's our role as the LMPCA and our representatives at the Coordinating Council to really make sure that that clinical viewpoint is always heard and that we're getting some real benefit to the system and our patients as well as the providers. So the current projects that are doing some of them, I just want to highlight a few things that are going on. There's a self-management website that's up and running now, which allows kind of a one-stop shop to find self-management programs for various chronic diseases and just general health issues. It's searchable based on location and dates that you're available and types of programs that are there. So I encourage you to look at that website, and that's an access point for patients or providers to know what's available. Online appointment booking, that's something that's kind of been new and kind of just coming down in sort of a bit of a tight timeline, but there is some one-time funding available right now for online appointment booking. It's for 1 year of funding for any of the online booking platforms, as well as some change management support to do that. The caveat is that it is only 1 year funding, so after that you'd have to fund it yourself, and there's no guarantee that, you know, if there's going to be some consolidated platform that's going to be recommended in 3-5 years, who knows what. But if you're already considering doing online appointment booking and you're thinking about doing it, or maybe you already have to some degree, but want help to use it even more, there is funding available for that. So there's a link, if we can put it in the chat there as well, and it'll be on the slide with active links when we send you the slides. But this one is kind of time sensitive. They want you to reply by June 16th, Thursday, if you could, because they're trying to get a sense of numbers of interest by the end of this week. So again, if you're thinking about it already or already doing it to some degree, it might be worth taking advantage of some funding. Our office just recently kind of started using online appointment booking, and it has, you know, reduced some of our phone calls, right? We had like for four docs, so we've had I think 40 or 50 appointments booked over the weekend. So that's, you know, 40, 50 fewer phone calls that our office had to handle. So and patients are certainly seeming appreciative of that option. So yeah, do that survey by June 16th if you have any interest in that. In terms of test to change, that's a big project ongoing right now, kind of early stages, but it's working towards population health registry and shared care record. Obviously really important, as we know, to have that information being shared about a patient moving from place to place within the system. It's still working in early stages of it, but I think primary care has really been involved, and they're making sure we're having lots of clinical input to make sure that it is useful and meaningful changes that will have adequate primary care input rather than just from the hospital or higher, bigger systems kind of dictating things. So it's exciting because I think we all know that it's important, but it's a big job. And that's so good that we have the OHT working towards that. Healthcare navigation is another one that's, I think, is really practical and of importance to us in primary care. It's kind of the goal is to have a 24/7 access point for patients and providers to find different programs within the community and help figure out, which one's the most appropriate, how to refer the patient to that. It's looking at, again, getting some project leaders and working groups going to start this kind of work, consolidating some of the information from 211, Healthline, Connects Ontario, all on one sort of platform, hopefully that will kind of simplify things and make it that one entry point to find these kind of programs. So I think a lot of us know that there's programs out there that maybe we didn't always know were available for patients that would need them. Access to primary care is another marker that we're looking at the OHT level now, which has kind of been brought to us, obviously, as primary care representatives. We moved away from just timely access, but access to primary care, because we felt that was important to really distinguish. So it's also looking at, physician retention, locums, how to decrease administrative burden to help reduce burnout, and also just helping within practice access within your own family practice. But that's early stages. We're looking for help with that, with working groups and education sessions, but also working groups trying to get more of a direction of where we want to head with that. So those are some of the OHT projects going on right now. There's a lot more going on out there. There's a link there to mention all of the different projects that are available. All of the leads are there, are listed there, and contact information. So if you have an interest in some of these projects, please reach out to them. They're more than happy to get primary care input for any of these kind of projects. One more thing that's available is 100 free licenses that are available for this Sega Shield cybersecurity training, online cybersecurity and privacy education program. It's 5 e-learning modules completed at your own pace, 7.5 main pro credits, and it's free. If you're interested, please email us and you can get you connected with who's running that, so we can get you your license if you have an interest in that. And then there are always some leadership opportunities for primary care. I think, more than ever, people are realizing how important it is to have clinical and primary care input to any of these projects, because we're affected by all of the things that are affecting the healthcare system, it seems like. So as I said, you can log into, so you can look at the project lists and take a look at the different projects that are out there. And if you have an interest, please contact the people involved. The LMPCA is often tapped on the shoulder to see who can be involved with some projects and needing some primary care input. So as a result, we've kind of looked to create a survey here to identify your strengths and interests. So if you have an interest in some parts of the healthcare system, whether it's digital or access or recruitment or referrals, what have you, mental health, just click on that, enter what you're interested in, and we'll keep a database of that. So if we get asked about projects that are ongoing, we will send out an email to you, but specifically potentially, or to the broader group if there's no specific person showing interest. The goal is really to get this leadership distributed as wide as we can, get all of your input, all of your skills used to the max, and really help spread that workload across the system, but make sure we have a lot of primary care input all across the system. We'll always make sure that we'll find out what's the duration of time required, how many meetings per week or month, how long is this project going on, 6 months, a year, 2 months, what have you, and whether there'll be funding and how much. So the OHT has been excellent about always funding primary care leadership. So that's been a great move from the OHT to really value our time and our input. So I think that's been a great avenue to get more people involved. So please look for opportunities there. And then the London Middlesex Primary Care Alliance, we're always looking for people to be involved with us and to make sure you get your emails and your newsletters. And there may be some opportunities on the executive side of things as we move into the fall, as we have some turnover in that realm of things. So that's a lot of stuff going on, as I said. Our focus today was the eReferral via eFax. I hope you can kind of get some of the excitement that we have as being part of this and seeing this live now, finally, after a lot of work to try to get this on the run. And a lot of people worked hard, Eric and Scott and Beth, and everybody's been working super hard to get this thing going. Hanady's here as well. And we're starting to see the benefits of it. So we really want to kind of spread that and have it really be this challenge to see how many, can we get as many family doctors as we can to use this platform? Can we get as many eFaxes and eReferrals done to help show the value of this and how committed we are to move away from regular faxing and really shift this system in the direction we need it to go. So really, thank you for your time tonight. I know it's hard to get people to come out on evenings for talks when we're all busy and all have families and work keeping us busy. But thank you again for your time. If you have any other questions, please shoot us an email. Otherwise, have a great night.